Now back to the coronavirus. As we hear about more cases and see schools shut down and events canceled, people are understandably anxious, not just about the virus, but how the threat of the virus is affecting our lives. I want to bring our Dr. Mallika Marshall back in here. This is uncharted territory for all of us. It is disconcerting, but you say there are ways we can tamp down that worry.
Absolutely. Of course, now I've just told you that it's being called a pandemic. So
Right?
I've gotten people all anxious again, but we're going to allay some people's fears. You know, in my dealings there with, patients, colleagues, friends, family, there are two different camps. There are people who think this is a complete overreaction, and there are others who are incredibly stressed. And what we'd like is for people to strike a balance, right? To be concerned, but not panicked. So we have some tips of what you can do. So number one, stay informed. Pick a trusted news source. Keep up to date on the latest recommendations from state and local health officials, but don't stay glued to the TV or to your social media on all things coronavirus. Turn off those notifications. I had to do that for a couple of days on your phone, and instead check in once or twice a day for the newest updates. Also, plan ahead. What would you do if you had to self-quarantine, or if your kids were told that they had to stay home from school? Don't allow yourself to get caught off guard, because that's going to make you even more anxious. And distract yourself. Go for a walk, read a book, exercise, watch a mindless TV show, talk to people, don't isolate yourself, and try to get plenty of sleep. And if your anxiety is becoming debilitating, you're having trouble working or going about your daily business, focusing, then it's time to talk to a professional.
All right, so connect, be prepared, seek help if you need it.
Exactly.
Patients with potential exposure, I know, have been told to self-quarantine for 14 days. A lot of things have changed in the last few weeks. Is that still good advice?
So right now, yes, because researchers at Johns Hopkins found that the median time between when infection starts and the onset of symptoms, that it's about 5 days. They also found that more than 97% of people who develop symptoms will do so within 12 days of becoming infected. So that kind of justifies this 14-day quarantine period. Even if a small percentage of people may sort of fall outside that window, the vast majority are going to get symptoms within that 14 days.
Outstanding. Dr. Mallika Marshall, thank you so much.